千葉県は外出の自粛などの要請をどのような形で行うか決めることにしています。東京都に隣接し、感染者が多数発生している市川市などの北西部や、感染者の比較的少ない県南部地域など、地域ごとにレベルを分けるのか、全域で同じレベルとするのかも検討する見込みです。そしてこちらはの様子です。安倍総理大臣はこの後7時から記者会見を行い、宣言を行う理由や具体的な措置などを説明し、国民に協力を呼びかけることにしています。ではニュース7です。こんばんは。
Good evening. This is News 7 for Tuesday, April the 7th. This program will be extended until 8:45.
Prime Minister Abe Shinzo has declared a state of emergency. It will cover Tokyo, Kanagawa, Saitama, Chiba, Osaka, Hyogo, and Fukuoka, the 7 prefectures, and it will last until May 6th. This is the Prime Minister's official office, and the news conference by Prime Minister Abe is about to begin. It will be held not at the usual news conference room, but at a large hall to make sure social distancing will be kept. The reporters are sitting apart from each other and are required to wear masks. Prime Minister Abe has entered the room. There are some photo shoots going on before he begins his address. We will begin the news conference by Prime Minister Abe Shinzo, and in order to avoid close contact, we will be holding this news conference in a large hall, and when you have questions, you may remove your mask and pose your questions. First, the Prime Minister will make his address, and then we will accept questions from the floor.
At the outset, on behalf of the Japanese people, I would like to express my gratitude to the doctors, nurses, assistant nurses, hospital staffs, as well as public health centers which are dealing with clusters, experts, clinical lab technicians. These people are, even now as we speak, making dedicated effort to save people's lives with strong dedication. I would like to express my sincere respect to all these people. Already, the virus has taken the lives of more than 60,000 people around the world. Their professional skills and sense of mission give all of us courage. I would like to thank all of you. The government is committed to doing everything within our means to support and protect these people who are risking themselves and making every effort to save people. Regarding supplies production in Japan and relying on a variety of companies from different industries to boost production. Patients with mild or no symptoms will be transferred to accommodations and not medical institutions to reduce burden on medical institutions. With the cooperation from hotel chains in Tokyo, 10,000 rooms, and in Kansai region, 3,000 rooms have been secured. Nippon Foundation is building a temporary facility. Leveraging facilities will focus medical resources to patients with severe symptoms and thereby maintain hospital functional. Despite these efforts in metropolitan areas such as Tokyo and Osaka, the number of infections is increasing and beds are running low. Physical, mental burden on medical workers is increasing, and medical institutions are facing a crisis. At this point in time, we have not yet reached the point where we are seeing rapid nationwide spread of the virus, but it is true that there are areas, regions, where the healthcare system is pressured. We reached the conclusion that we have no time to waste. We judged that there is a risk of serious threat to people's livelihood and the economy. Today at this news conference, we have Dr. Omi Shigeru with us. He is heading the advisory expert panel, and with the consent from the panel, based on the Special Measures Law Act Article 32, a state of emergency has been declared. The declaration covers Tokyo, Kanagawa, Chiba, Saitama prefectures in Kanto, Osaka, Hyogo prefectures in Kansai, and Fukuoka prefecture in Kyushu. Tokyo is recording the largest number of infections. Targeting the end of this month, Olympic-Paralympic facilities will be refurbished to accept around 800 patients with mild symptoms. In line with the emergency declaration, if necessary, medical staffs from the Self-Defense Force will be mobilized, and under Article 48 of the Special Measures Law, temporary medical facilities will be set up. To relieve workload of medical workers, what is most important is to contain the infection. First and foremost, people need to change their behavior. The authorities stipulated in the Special Measures Law are to be exercised by the governors of the prefectures. The central government believes the 7 prefectural governments should, under Article 45.1 of the Special Measures Law, request its residents to refrain from going out unless there is essential need to do so. The situation is pressing. In Tokyo, the number of infected persons has exceeded 1,000. In the last 5 days, the number has doubled. If this pace should continue, in 2 weeks, the number will reach 10,000, and in a month, 80,000. Experts estimate that if everyone makes effort, however, and if person-to-person contact is reduced by at least 70%, possibly 80%, in 2 weeks, the spread will peak out, and we will start to see the number of cases, new cases, decline. If so, we will not only be able to avert an explosive increase, but also it will become possible to contain the outbreak by focusing on clusters. We need time to examine the effect of these measures, and therefore the emergency declaration will be in effect until May 6, for 1 month, we will aim to reduce contact by 70% to 80% and make stay-home requests. I repeat, in order for us to overcome this emergency in 1 month, we need to reduce person-to-person contact by 70 to 80%. This will for sure be a challenge. We have already called on companies to implement telework and enable the employees to work from home. Except for work needed to maintain social functions, office work in principle should be done from home. If there is a need to go to the workplace, rotations should be set up to reduce the head count at the office by at least 70%. Going to work at different hours is another measure. Also at the office, social distancing should be implemented. We ask companies to implement these measures. Restaurants, if kept open, should have thorough ventilation and distances amongst the customers should be kept. School closure will be extended, but we will work to set up in the environment for distance learning. Patients being examined for the first time will be able to use remote service. Going to hospitals increases the risk of infection. Patients who are worried may decide not to go to medical institutions. We need to avoid this from happening and implement measures. In the event of going out for essential reasons, such as shopping for daily necessities, people are requested to avoid the 3 C's: closed, crowded places, and close contact communication. There is no problem going out for a walk or jogging. Meanwhile, please refrain from going to places where the 3 C's overlap, such as bars, nightclubs, karaoke parlors, live music venues, amongst others. Please also avoid going to large gatherings, events, and parties where many people outside of your family will come together. What is dangerous, threatening about the virus is that despite showing no symptoms, people infected can transmit the virus to others. There are many cases where infected persons transmit the virus without knowing. Everyone, especially young people, should always think that they may have the virus. When going out, please avoid crowds and practice social distancing. Please also wear face masks to avoid droplet infection. These actions will save lives. Other people I ask for everyone's cooperation. These emergency measures will also have economic fallout. Even now, small medium enterprises, self-employed businesses are seeing their business disrupted. It is no exaggeration to say that the global and Japanese economy is in the midst of the worst crisis since the end of World War II. Against this strong sense of crisis, and to protect jobs and people's livelihood, one of the world's largest economic measures package, totaling 108 trillion yen, which is equivalent to 20% of the gross domestic product, will be implemented.
For households in difficulties, mid to small size companies, we will have a cash payout of over 6 trillion 300,000 yen per household. With the next childcare allowance payment, each child will receive an additional 10,000 yen to support the household finance of families with many children. The backbone that support the Japanese economy is those working in mid and small sized companies. In such painful situation, you're biting your teeth, working with grit. You are the real strength of Japan. Your voices are reaching us. We will not put your hard work to waste. Based on this spirit, we have established a financial support system, a first in history for such businesses, for mid to small size firms that saw significant declines in sales, 2 million yen. For freelancers, 1 million yen will be paid. We will reduce fixed asset taxes. We will extend the payment deadline by 1 year for consumption tax and social security payments. There will be no overdue charges. By providing a grace period for a total work for business continuity. Private sector, regional banks, Shinkin banks, credit unions will also provide loans with no real interest, no collateral, with up to 5 years grace period on payment of original principal. Furthermore, a historic increase in the subsidy rate of the employment adjustment subsidy will be in place. We will mobilize any conceivable policy measure. This is our resolve to overcome this largest crisis since the end of World War II, together with the Japanese people. This declaration of state of emergency is not a lockdown as you see overseas. I will be clear on this point. Trains and buses, public transportation will continue to operate. Roads will not be closed. Experts say there is absolutely no need for such measures. When we look to overseas lockdowns, many people fled the city, causing confusion and further outbreak. What we need to fear right now is fear itself. I'm sure it's fresh in your minds. With false information spreading on social media, toilet papers became scarce in stores. A virus, an invisible enemy, is something that makes people anxious, including myself. But in such times, social media's role, essentially, is a tool to bring people together, to bring unity to society. I believe it has a great strength to alleviate social anxiety. But if we are caught up in fear and we are in a panic based on false information that has spread on the media, then this could impose a larger damage than the risk from the virus to our economy, society, and lives. Experts say that the risk of infection in Tokyo and Osaka, even at this moment, is not that high if we refrain from non-essential, non-urgent outings and lead our normal lives. So it is completely different from cities on lockdown outside of Japan. That's why we ask you to refrain from moving to regional areas. In the regional area, there are many elderlies who are at a higher risk of developing serious symptoms. Please make sure your action does not increase their risk of infection. Of course, we will maintain functions necessary for our society to operate. In cooperation with local governments, electricity, gas, telecommunication, financial services, garbage collection, and incineration, and other support services for people's lives will continue to operate as usual. For those who are working in facilities for the elderly and childcare, we ask for your ongoing cooperation for people who require services. For those of you who work in manufacturing and processing of daily necessities such as food, for those in logistics and retail, please continue to operate your businesses. So, I ask from the bottom of my heart that all of you take calm actions based on accurate information. In these 2 months, our lives have changed dramatically. The live concert you were looking forward to was canceled. You were supposed to have gone out drinking with your friends. That was canceled. You can't go to places you want. You can't see the people you want to see. The ordinary life as we knew has been lost to us. But by your individual actions, we can for sure save many lives. I would like to extend my deepest gratitude to each and every one of you for your cooperation. To be honest, measures by government and local governments are not enough to overcome the state of emergency. This is the undeniable fact. Can we avoid an explosive outbreak and increase of infection cases? Can we save as many severe patients from death? Can we protect you and your loved ones, your families? It all depends on your action. I would once again ask for your cooperation. We can't see ahead, even in such uncertainty. Hope can be born. Throughout Japan and the world, companies and researchers are getting their wisdom together to develop vaccinations and drugs. Approved as a treatment drug for the new type of influenza, with side effects also being identified, the drug Avigan was prescribed already in more than 120 cases, and there are reports that it's been effective in improving symptoms. Under observatory research, we are hoping to expand usage to all patients who wish for this medicine. We will stockpile triple the current amount of Avigan for up to 2 million people. For necessary raw material production for domestic production of the drug, many companies throughout the nation have offered their help. Auto manufacturers are helping in ramping up production of artificial respirators. Airlines, seeing many cancellation of flights, have offered to help in sewing and producing protective gear for hospitals. For school children, there are people sending handmade masks for when schools resume. Truck drivers are protecting our logistics system as we speak, day and night, to fill the shelves of our supermarkets with daily necessities. For the medical workers, There are people trying to contribute in their own way by starting a crowdfunding. Japanese Nursing Association is calling out to 50,000 nurses who are on leave. And I myself will also like to ask those nurses who are on leave at this national crisis to fight against the virus. We need your help. Responding to the call of the nurses associations, there are nurses already who have offered to come back to hospitals to save lives. In various fields, at this crisis, there are many people standing up to do what they can. This is the hope. 9 years ago, we experienced the Great East Japan earthquake. Lots of people lost their precious lives. They were hurt, and they lost their loved ones. In such painful, tough times, what brought us hope was the bonding among our people, the will to help each other throughout Japan. Again, we are facing great difficulties. But if we put our strength together, we can once again have hope and move forward. We can win this battle against the virus. This testing times of state of emergency could be overcome. I am sure of that. That is it from my part.
And now we'd like to take questions. Those of you who have questions, please make clear to whom you would like to ask the question. We would like to ask Dr. Omi to also respond to the questions depending on what is asked. Dr. Omi is the chairman of the Advisory Experts Committee. Those of you with questions, please raise your hand and please wait until you're recognized, and please come to the microphone nearby. State your name and affiliation before asking your question, please. Please raise your hand if you wish to ask a question. First from the lead press. Yoshida from Kasha. As a result of this emergency declaration, the governors of the 7 prefectures will be able to take measures based on law. And this is a very difficult decision which will constrain people's lives. But compared to overseas, it is said that the binding force of these measures are weak. And therefore, in order to prevent the spread of the new coronavirus, we need cooperation of the people. In order to win this fight against the virus, in order to solicit voluntary action from the public, what do you think will be necessary? And what do you expect to see in 1 month's time? If in case you will continue to see a spread of the virus, are you planning to introduce new measures which are more binding? About this emergency declaration, as you stated, compared to overseas, other countries, for example, the lockdown measures, compared to those measures, these measures do not have strong binding force. But what's important is that the Japanese people cooperate. We need to ask the Japanese people to change their behavior because this is of utmost importance to bring an end to this outbreak. I think that is what is most important. According to experts' estimate, if we make efforts, and avoid people-to-people contact by at least 70%, if possible 80% in 2 weeks' time. We will speak out the new cases of the coronavirus infection and start to see a decline. We will be able to see the end of this tunnel. And for this, we need to have everyone cooperate. 70%, 80% reduction of people-to-people contact will not be easy, but if everyone cooperates and complies, I'm sure we will start to see the effect. I would like everyone to start thinking about this and taking these measures from now. One more question? Goto from Tokyo Shimbun newspaper. Now, about the emergency economic measures you announced. In line with the emergency declaration, the governors of the 7 prefectures will have to ask most outlaws to close their commercial activities, but to the small and medium enterprises and others who will be largely impacted by these measures, do you think that the economic measures that you have set out will be sufficient? And also the 300,000 yen per household benefits, and also the 200,000 yen benefit to those companies and enterprises which have seen their sales decline. And this may trigger people to criticize that some people have been left out. How are you going to try to provide a safety net to those people who will not be subject to these benefits? Now, we have called for the cancellation of various events and also at bars, etc. We've asked a number of people to close down their business. Despite them making every effort to run their business, they will be suffering. But we need their cooperation. Now, how are we going to support these people is the question. Well, the losses incurred will not be limited to one single industry. Instead, it will have to others outside of that specific industry. And therefore, we believe that we need to try to provide compensation to those people who are suffering most. And that is the reason why we are focused on the small and medium enterprises which are seeing their sales go down, and we will be providing benefits amounting to 2 million, 1 million yen. And these people, these companies are suffering because of the low cash flow, and therefore for 5 years a no interest loan will be provided, and a grace period of 5 years will be provided to repay the principal. And if there are cases in which it's taking too much time to obtain these loans, please tell us. Tomorrow there will be a gathering of those from the financial institutions at the Prime Minister's office, and we will discuss these. Also, we will provide grace period for payment of taxes and social security premiums. And we want this money to be used for businesses and also to retain and maintain jobs. And we want to take all measures possible. About the 300,000 yen benefits, well, at the LDP, there was a suggestion that we should provide the same amount of money to everyone. For example, we, the parliamentarians, others, there are people who have not seen their income go down as a result of this outbreak. And is it wise to provide benefits of 50,000, 100,000 yen to even these people? We concluded that we should provide direct benefits to those people who've seen their sales go down. And we want to do this as speedily as possible. And that is the reason why we're saying May. Once the supplementary budget is compiled, we want to make the payment as soon as possible. And during the ASO administration, if we try to do it for everyone, it takes 3 months. And we want to do this speedily. And that is the reason why we are focusing on these people. We have to draw a line somewhere. It's hard, but as I've just explained, we will provide the benefits that were listed in the package. We want everyone to cooperate to overcome this crisis, and that is the reason why we made this decision.
We will now accept questions from other companies. Please raise your hand. I will name the person, so please come to the microphone and state your name and affiliation, and please limit your questions to one. Matsumoto from NHK. With this decision, I'm sure you had many coordination and data you had to look into, and some are criticizing that the decision was too late to declare a state of emergency. If this decision were to be made a little bit faster and earlier, there are voices that say that the spread could have been contained. How do you respond to that? And up until now, there's been a lot of extraordinary measures calling on events to be canceled and schools to be closed, but that did not help in containing the situation. How do you analyze the current situation? First of all, this revised law on the new influenza, the state of emergency declaration, I have been thinking on the right timing to declare this. If you look back on the discussions and debate, we needed to become prudent because it also imposes restrictions on people's rights. But we were being very careful and cautious in monitoring the number of cases, and analysis was made by the experts. And we called on events to be canceled, and we have also closed schools. But we couldn't prevent the spread. That might be true, but how about the speed? If you look at the global situation, you see an acceleration in the number of cases increasing, and that's very important. In China and South Korea, there's a larger amount of those infected and death as well, but the speed has decelerated. And so, Japan, although small in size, we want to contain the situation and peak out so that we could see a reduction in the number of infection cases. Since last week, we have been discussing when to declare the state of emergency. Every day with Dr. Omi as well as Minister Nishimura, we have been discussing this. We cannot just out of the blue declare this. We need to have the analysis and recognition and approval from the experts. They made their expert decision first. Of course, there was the cumulative number of infection and also the rate, the speed of the increase, and also the medical services situation and what we could do as government. If we were to issue this declaration of state of emergency, we needed to have the medical services in place so that it could respond to what will come after the declaration. That's the reason why last week, including myself, I met with the CEOs of hotel operators, and we asked them to accept those with lighter symptoms. And with such preparation in place, if we go ahead with the declaration, the patients with lighter symptoms and with no symptoms could be accommodated at these hotels. and we needed to avoid any confusion among the Japanese people. First, we had to have people have a better understanding. At the onset, there was a misunderstanding that Japan will see a case of a lockdown. So together with Dr. Omi, we together had been working in a united manner. And yesterday we had the discussions and decisions, and today we are now ready to make that declaration. We will go to the next question. Ishigaki from Jujitsushin. Prime Minister, in your address, you urged the Japanese people to change their behavior, their actions, to reduce contact from 70 to 80%. In the 7 prefectures, and those people who are not within the scope of the 7 prefectures, I think they are confused as to what is called of them. So can you send a message to people who are not within these 7 prefectures within the scope of state of emergency? Well, first of all, the expert, Dr. Omi, will explain about why the other prefectures were not within the scope of the state of emergency. Yes, they're not within the scope, but we never know when the spread will hit these prefectures. So please continue to be on the alert for the 3 C's. So Dr. Omi, would you like to address the other prefectures? Yes, your question was pertaining to other prefectures. Let me first explain why we selected the 7 prefectures first. That will also give you a response to why the other prefectures were not in the scope. The experts, what we proposed to the government was that there were 3 indices. One was explained by the Prime Minister already, the cumulative number of reported infection cases. And second is the time, the speed of multiplying by 2 the number of infections, and also the number of cases where we cannot identify the link of infection. So for the past 3 weeks, we have been following this day in and day out. And in Osaka and Tokyo, the cumulative number exceeded 400, and times 2 speed, the time for the double in infection. In Italy, it's about 2 or 2.5 times. But in Tokyo, in first half of March was about 10 to 11, and recently it's been 5. In Osaka, 6.6. In Tokyo, it's 68% in the latter infections where we could not follow the links, and 50% could not be identified for their links. But what we call, it's a local entity, it's a different jurisdiction, but these other neighboring prefectures come under the scope of where people move around. And so for Osaka, Hyogo Prefecture is close to the Osaka's picture in terms of infection cases. And Fukuoka, the cumulative number is still small, but there are 2 important unique characteristics. The double time period, the time necessary for the double infections is the shortest nationwide. It's only been 2.9 days, so the shortest, and the unidentified link is the highest, 72% as of yesterday in Fukuoka. So that's the reason why we chose these 7 prefectures. Other prefectures compared to the 7, of course, there is a risk of an outbreak or spread, but as of yesterday, compared to the 7 prefectures, it is not at the same level. But there are still risks of infections, so we ask them to be on the alert for 3 C's as well.
Next question. Yoshino from Television Asahi. Prime Minister talked about the medicine, drugs. Avigan, remdesivir are said to be effective, but about Avigan, you said that you're going to stockpile And if the patient requests, you, I think, said that the drug will be administered. But couldn't it be that people are, this drug could be used more flexibly? And when about will this time come? Well, Avigan is a Japanese medicine, and Lubesco, Amapsan, there are these medications. And this remdesivir is a U.S.-Japan jointly developed. And there have already been 120 cases where Avigan has been administered and effects can be seen. And in 30 countries, Avigan are requesting that Avigan be sent to them. So we're receiving requests from 30 countries saying that they want Avigan. We have started a clinical test from March 31st, and together with these countries which are wanting this drug, we want to do the test and increase production. Now, then, supposing that we are infected, we are hospitalized, and want Avigan to be administered, would this be possible? I think was the question that you asked. If the patient requests that Avigan be used, of course, there's a side effect. Expecting mothers cannot use this drug, but I'm sure the doctors are fully aware of this. But if there is a request to use Avigan, and if the clinical experts hold a meeting and decide that this is acceptable, then Avigan can be administered based on an observation basis. So if the patient requests to their doctor that they want Avigan to be administered, and if the doctors at the hospital approve, then it is possible. And at several hospitals, they've already given the approval to use Avigan. Next question, please. Nihon Keizai newspaper, Shigeta. About the effect of the emergency declaration. And it starts from today, but from when, or what time did you say? Will it take effect? I'm not too familiar about those details. At what time? Tonight? And about the closing down of stores. You say that the governors have the authority to make the request, but for those stores which have a space of 1,000 square meters or less, the central government has the authority to make the request. So how are you going to collaborate with the local and central government? And also about the Tokyo barbers and also childcare facilities and the home for the elderly. You say that in principle these facilities will continue to be in service, but what is your observation about these? About the floor area, if it's less than 1,000 square meters, then the health minister, if it is under the minister's administration, based on the past cluster cases, the minister can designate. But there's a misunderstanding here. But this is a case-by-case approach. So it's not in general. For example, it's not the case where a certain community is designated every store which is under this condition is to be closed. Instead, no. It's just a specific store. And it's not the whole industry. So you have to understand that it's a case-by-case approach. And about the barbers, there are no clusters identified regarding barbers, and therefore the health ministry has stated that the barbers will not be subjected to those entities which will be requested to close. But beauty parlors, because they are thought to be necessary, um, and currently, Minister Nishimura and the Tokyo governor is going over these details to make sure there is a common understanding. And for the child care facilities as well as the facilities for the elderly, for example, the child care facilities, if there is a need for children out of school to be looked after, then those cases will be admitted. And for the facilities for the elderly, if it's a facility that is necessary and if measures are taken to prevent an outbreak infection, then they will be able to continue their business. I think that because this is a necessary facility, they will continue.
Egawa Shoko, a freelance journalist. You talked about 2 million yen to mid and small size, and freelance and other individual business owners, 1 million yen payout. And what are the conditions for making such payouts? For households, you are paying 300,000 yen, but the conditions you set were very stringent, so only part of the people who are in need will be receiving that money. And what are the conditions that will be in place for this 2 million and 1 million yen? And if that is not lax enough, maybe after 1 week, this is not binding in terms of the restraints you are setting. Therefore, people will become complacent. And would you be calling, for example, the police to be mobilized so that they could question people who are roaming around the city? Would this be a possible scenario or not? The mayor of Chiba City said that the police have already tweeted that they are demanding and requesting the police to be on crackdown of the nightclubs and other commercial outlets. Would that be a scenario? Well, first of all, the mid and small sized companies, as well as freelancers and individual business operators, the payout plan of 2 million yen and 1 million yen for all and almost all in various fields, they have lost their income by 80% in some cases. And so by until the end of this year, compared to the previous year, if their income has become half of the previous year, then they will be entitled to receive that money. I know that they're in a very tough situation, and especially in the industries where they are called to refrain from operating, that will occur. So even in 1 month period given within the whole year, it's not just annual. So the design that we have in place will be 1 month if they have an income that is less than half of the previous year's levels, then they will be entitled to such payouts. And we would like to do this electronically as well. And some people who have difficulty doing this electronically, they could apply for that through their local chamber of commerce, and they might have assistance to make the application. Oh, and your question regarding the police. This is about mobilizing the police, and anything we have asked, it's not within scope of police crackdown, but we might ask the police to help out. And regarding the requests we are making to the people to refrain from certain actions, we don't know what it might look like, but we might ask for their help as well. Another question?
はい。開店。開店。
Sugahara from Nippon Television. In the overseas cases, for a prolonged lockdown, there's been a lot of domestic violence, including child abuse, and to their spouses or partners. And in Japan, it hasn't been prolonged yet, but what is the current situation? Does the government have a grasp on the reality of the domestic violence cases today. And also, there might be some shelters that come under the 3Cs. So, how would you think about and approach such shelter operations? Yes, overseas, I am aware that the DV cases have increased, and domestic violence is a serious issue. But domestically, I have not received any report yet that such DV cases are on the rise. And we are starting this emergency situation from today. So we want to ask everybody to refrain from going outside. So we will keep a close eye on the situation. If we discover such a situation, please call the government immediately or for help immediately for domestic violence as well as child abuse. As early as possible, please contact the authorities. And also, for shelter operations, in this fiscal budget, we have allocated more budget and measures to beef up the shelter operations. And if we would like to make sure that 3Cs will be avoided at the shelters as well to avoid any infection.
Romai from Nihon Shimbun newspaper. Prime Minister said that people should refrain from going to other regions outside of these cities that have been designated, especially the young people. We see that they're moving out from those areas that are designated, escaping these restrictions. Meanwhile, these infected young people, once they go back to their parents' home, they transmit the virus to their parents and others. So, does the Prime Minister have a message to the young people? As I said at the outset, this new coronavirus, even if the person is infected, it might be that there are no symptoms. And without noticing, that person could transmit the virus to others. So this is what is scary about this virus. It is important that people think that they might be infected, especially the young people. I hope that they will have that awareness. Of course, the young people are physically strong and they have strong immunity, so they might not recognize that they're infected, and without knowing, they may transmit the virus to their parents or grandparents. If the elderly people are infected, then there is high risk that they would develop severe symptoms. There will not be any lockdown in these prefectures. The functions will be maintained. And therefore, I would like to encourage people to stay in Tokyo as much as possible. I think we are approaching the closing time. This will be the last question.
And now from Nico Nicodo. I'd like to ask about the collapse of the medical system, and in the medical field and the hospitals, there will be a triage where people will have to select among those patients who have a likelihood of surviving. This triage could occur here in Japan as well. What is your thought on this matter? And let me just confirm one point. Prime Minister, you talked about the strength of the social media, the internet. This is the first time, and for a very long time there will be this state of emergency in place, and the voices on the internet is reaching the government. You yourself, the Prime Minister, can we interpret your comments as to be so? First of all, this triage, selecting those who have a likelihood of survival, we are trying to everything to avoid triage, and it is a difficult word used in the medical field by doctors and nurses. When you think of striking a balance, if there are patients A and patients B, you have to select A or B, and we want to avoid such a scenario. So we're taking necessary measures, especially focusing around those with heavy symptoms, and it's very important for such, with the economic stimulus package, we are prioritizing beefing up the medical services and ensuring more facilities and having more doctors and specialized doctors as well as nurses. And also together with the doctors in other fields such as cancer, we will collaborate with them as well. And we are currently not in a situation where we need to resort to triage. And it is true that the medical system is strained at this moment, but there are still patients with light symptoms and with no symptoms who are in the hospitals, but they will be moved to about 10,000 rooms that are in hotel rooms that are being provided for such lighter symptom patients. And so this is going to free up some beds in the hospitals, and also for the elderly who have a high risk of severe symptoms, we want to contain infections to them, so we will do anything we can. As for the role of the internet and social media, when we had natural disasters as well, the information sometimes spreads very fast and speedy from what is occurring on the field. Coming from the government, the real-time information with pictures and live feed do come on the social media internet. So in the Abe government, we have created such a mechanism in place to tap into such resources. And also for regions where the government cannot reach quickly, we are using the information from internet, and we are keeping an eye on what's going on in the social media as well. This concludes our news conference. We are sorry that we cannot accommodate all questions, but this will conclude the news conference. One more question, the last question. I am very sorry, but this is an Italian journalist that I lived in Japan for a long time. Up until now, globally, you see countries resorting to lockdown. But Japan, compared to other countries, is like heaven. And you've taken various measures. Some you took quite a risk